Hello everyone, I'm Dr. Akshi Bansal. I'm a dermatologist and hair transplant surgeon with Manipal Hospital Whitefield. Today I'll be talking about a very common condition called as Polycystic Ovarian Syndrome or PCOS and its impact on skin. PCOS, now although the name says only ovaries, is actually a multi-systemic condition with impact on not only your reproductive and menstrual health but also on skin, hair and metabolic health. There is an underlying hormonal imbalance with an overall increase in the androgen levels, most particularly testosterone. Now, testosterone is classically a male hormone, but it's also found in women's body, but in very small proportions. In PCOS, there is an overall increase in the activity of testosterone, which results in signs of virilization that we get to see. There is oligomenorrhea or irregularity of periods. Then there are skin signs and symptoms in the form of increased sebum secretion or oiliness of skin, seborrheic dermatitis. There is altered pilosebaceous or hair and oil gland dysfunction resulting in facial as well as body acne. Then patients can start growing hair where conventionally men have thick and coarse hair in the beard area, in the moustache area, front of the chest, especially around the nipples, maybe around the abdomen area, at times even in the middle part of the thigh and on the back as well. A couple of patients can also present with pigmentation or darkening of skin in the areas such as nape of the neck and in the underarm areas. Apart from that, there are of course metabolic consequences like obesity or increase in the weight gain. There is increased predisposition towards developing diabetes mellitus, dyslipidemias, hypertension and even cardiovascular disorders. Now, not all of these signs and symptoms have to be present for us to diagnose a case of PCOS. One of the most commonly used criteria is Rotterdam criteria, which states that presence of 2 out of these 3 conditions is required for diagnosis. One is irregularity of periods or oligomenorrhea. 2 is either clinical or laboratory signs of altered androgens or increased androgens. And 3 is abnormality in the ultrasound showing signs consistent with polycystic ovaries. Now, this is very important for us to understand that even though you have completely regular and normal periods, you may still have PCOS. Now, although the awareness about PCOS is rising, I still get a lot of women telling me, "But doctor, how can I have PCOS? My periods are completely regular." So if you are somebody who's struggling with stubborn acne or is having coarse and thick facial hair in the chin area, in the upper lip area, in the chest area, it could be a sign of underlying hormonal imbalance. So please consult your dermatologist and get yourself evaluated. Thank you.